Ladies and gentlemen,
This is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports. Here's your host, Sean Keating.
Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week has been in the dental field for over 20 years. She is a firm believer in minimally invasive dentistry and evidence-based practical solutions for dental care, a member of the ADA, AGD, and the American Academy of Cosmetic Dentistry. Practicing from Green Valley, Arizona, please welcome Dr. Caroline Ogunware, DDS. How's it going, Dr. O?
Going great. Thank you for having me.
Oh, man, that's so cool. I can't thank you enough for coming on board, man. You're crushing it here at Keating Dental Arts, man. Last month I was looking, you're like top 5 out of hundreds and hundreds of doctors, man. And it's Dr. O, freaking just awesome. Thank you so much for all the awesome work. And
it's definitely been a blessing to, have a lab such as yours that does such great quality work. Usually, like I said, we're in Green Valley, so in the summer it gets pretty slow. But even though, the predominant patients that we see are older patients, I like a quality lab. Like if it's something that I'm putting in place and it doesn't look right, I'm going to resend it back.
Oh, that's good.
So far, so good. You guys have been doing a great job. I haven't had to send back any cases. Yeah.
Oh, that's so awesome, man. I love hearing that. But so that's so cool. Now, what part of Arizona is that? Now, where are you, say, from like Scottsdale or Tucson, or you guys tell me what you're in between or something where Green Valley is?
So I would say Phoenix or Scottsdale is about 2 hours from Tucson, and then we're south of Tucson. So at about, I would say 45 minutes south of Tucson.
No kidding. Green Valley, yeah. Man. I always see that with like the Green Giant or something like the Green Bees. No. Oh, that's funny. Well, heck, I always like to start off talking a little bit about sports. You watch any of that basketball game last night, the NBA Finals, little Golden State against the Cleveland Cavaliers? Did you get a little bit of that or no?
I did. I actually watched a little bit of it just because my fiance said, you need to watch LeBron James. He's one of the best basketball players. He's going to make history. So I said, well, I don't want to be one of those people like 20 years later that they ask me, did you go and see that basketball game? I go, I don't know who you're talking about or I don't know how to relate to it. So yeah, I did watch the game and I was pretty sad that the Cavaliers didn't win because here's LeBron James, one of the best basketball players they say in the world. And he's going to, at the end of his career, if he stays with the Cavaliers, it's not going to have anything to show for it. It's pretty sad.
Well, he's been to the last with different teams. I mean, he used to play with Cleveland and he went to a couple of the finals there, and then, he didn't like his team, so he went and bolted to the Miami Heat, and they won actually, I think they won 2 championships there. And then he went back to Cleveland and all the people welcomed him back. And then they've been in the playoffs the finals the last 4 years with Cleveland, and they've won it once. And so they played against Golden State for the last 4 years too. And, so he's going to bolt probably after that. He's just such a phenomenal player. I mean, he scores like 50 points a game, 40 points, and gets 10 rebounds. And he's just like a superstar player, but he's got to get better guys surrounding him because one guy can't win it. You need 2 or 3 studs. And, but he's probably arguably one, if not the best basketball player there ever was, just with his numbers and his stats. And it's actually a pretty laid back, kind of keeps his mouth shut, just real humble guy. And, he started in the NBA out of high school as an 18-year-old. So he's been there a long time. I always kind of never liked him, but as I look at his work, what he's done through the years and all the accomplishments that he's achieved, hats off to him. The dude is a stud, and he's I just it'd be kind of cool if he came to Lakers with our young guys, man. I never liked him in front of a lot of people. I say, LeBron, but he comes to Lakers. I say, I love him. I've always liked LeBron.
Someone told me that he already said that he's going to, is it 46ers or something like that?
76ers. Yeah. And they got a nice young team with Simmons and Embiid. I mean, they would be huge he could go either there or the Lakers is what they're saying, because, he just bought a freaking $20 million home in Brentwood and it's just like, he's thinking about, his children. He's got young kids, and LA is Hollywood, and he's got a bigger career after basketball. He likes to produce and direct movies and different things in the film industry. So he's a real sharp cookie when it comes to business too. So I think, I think it's a Hollywood thing for him maybe, but hey, Philadelphia 76ers, you never know. He will go to the best place he has a chance to be in the finals again. And he's been there 8 years in a row with 3 different teams. So he's pretty amazing.
But I would think the key thing that you said too is you can't be the number one all-time star and be able to produce what you do. Same thing in dentistry. You can't just be, all the way up here and then your team is trailing behind you.
Exactly.
You got to surround yourself with team members that are on the same level as you and want to achieve or accomplish the same goal. So
that's so true. Yeah. And I always say that in any business, man, you be a plumber, a painter, a lawyer, or a doctor. If you don't surround yourself with great people, you're only going to be as good as your people. And that's why every great business has just got great people surrounding them, and they let them do what they do best. And, the owners don't micromanage, and they really empower the people. And, it really works out well for whatever you do in business life. Surround yourself with good people and good things are going to happen. Oh, man, I'm an idiot. Okay. Well, hey, let's dental up, man. So tell me, I know you've been in the field for 20 years, but I know how young you are. And I know you graduated in 2012, man, which is heck. I got pants older than that, but no. No, actually I don't, because I went to that many years ago. I couldn't fit in those things. Those were 38s. I'm up to 40 now. Okay. Tell me, you've been involved in dentistry for 20 years, but tell me, why did you get into dentistry, and at what point did you think, I want to be a dentist?
I think since I was a kid, every time I went to the dental office, it wasn't just like, oh, you're going to have your teeth cleaned. It was always, you're going to have your teeth cleaned and you're going to have like 8 cavities filled. So when I was a kid, I can never ever remember a time that I just had my teeth cleaned. It was always like a filling or a root canal or something. So I felt naturally that, okay, I'm always, in this dental chair, I might as well ask questions and figure out this whole field. So it was, to me, I felt like it was natural. I always had nice assistants. They would always tell me about the procedure, even though I was a kid. And, most of the time we think kids don't listen. Kids don't really understand, what's going on. But they were nice enough to explain the procedure. I would always turn around and ask them about the instruments and equipment, and they would just always tell me about it. And then when I got a little bit older, I was in high school my junior year, and they had a dental assistant class that I could take at the technical center since I was done with all of my major high school classes. So I took that my junior year, and then my senior year, we went out into the field and was able to get a job, and I worked for my family dentist. So when I was a patient, this is crazy. When I was a patient, he was so nice and friendly. And then when I was his employee, it was like night and day. This guy was like a tyrant, which was great because he was very, very particular. So I knew exactly, okay, this is what, this is work that looks good. This is acceptable. This is not acceptable. And one key thing that I always took away from what he would do is he would learn a certain procedure. This was when implants was like starting to get big, but he would take us with him. Like I got to meet Carl Misch.
Oh, you're kidding.
No, I kid you not. And this was crazy. This was back in, it had to be 2001 that we flew down to Philadelphia, and they trained us assistant on what we needed to know, how we set up a room, how we make sure everything is supposed to be sterile and things like that. So ever since then, I said, you know what, if I, become a dentist and I, take this thing all the way up to the top, I'm always going to include my staff members because they're an important part of the team.
Absolutely. No, that was a gem of a jewel there that old Mish gave you, man. That's God rest his soul too. And That's awesome. So all the way back then you were doing it. And then, so tell me, where did you go to school? Tell me about your journey there on how that worked out after being assisting for so long from junior in high school. And then when did you say like, gosh, I want to be a dentist or I'm going to start going to school? Tell me a little bit about your journey of your thoughts of getting into dentistry and where you went to dental school.
So after I graduated from high school, I always worked as a dental assistant, but I did have, other part-time jobs on the side,
Okay.
like working at McDonald's and things like that, and Domino's.
I take a Big Mac.
I would, yeah, those are great. But I always tell people dental assistant was the only job that I didn't get fired from. It was the only job that did not feel like work. So that's what I said to myself, you know what? I love the dental field. It doesn't feel like I'm going to work. It should be like illegal to have this much fun, when you actually go in and, you're seeing people. So I went to Virginia Commonwealth University.
Okay.
That's in Virginia.
Hey, they got a good basketball team, Virginia Commonwealth, don't they?
Yeah, we didn't have a football team, but yeah, they had a really good basketball team there.
Yeah, they've been crushing it lately, the last few years. Who was that coach? That was I forgot the guy's name. He had a weird name, but okay, keep going.
And I graduated in 2004. And then I got into Washington University in St. Louis.
Oh, okay.
And got a master's degree in biology there. And I did a lot of research while I was there. And that's how I kind of figured out too, research wasn't for me. Very boring. Never see patients. You're just in a lab, just doing work. So after I went to WashU and graduated, I got into Midwestern University. And the reason why I chose this school was when I first went there, they actually didn't have the dental school built, but Dr. Simonson was there and he was telling us about his vision for this place. He was saying, this dental school is going to be state of the art. It's not going to be taught like any other dental schools in the country. When you guys do see patients, you're going to see your patients from start to finish. They told us we're going to be able to place implants because there's no residents. We're going to be able to do perio surgery. We're going to teach you everything that's involved with basically when you get out of dental school, you're going to be able to work like you've been practicing for 5 years. So that right there was already like the selling point for me to go to Midwestern. Just state of the art facility. Everything was brand new, no paper charts, everything electronic. I had a really great positive experience at my dental school. And after I graduated in 2012, I started working corporation, the evil corporation.
Yeah. Hey, but you
nobody really wants to do corporate.
Yeah, but you got a lot in the trenches there. I bet you saw a lot of people, man, huh?
Yeah, I did. I saw a lot of people, but I always say it was a blessing because, being a dental assistant was a blessing.
Yes.
Because when you go to dental school, you can actually, know the reason. Okay, you're doing this for this reason.
Oh,
and sometimes, you go to dental school and some people are book smart and, they don't really have the hand skills or can't really transition that quickly. So for me, it was an easy, natural progression.
No kidding. So how long did you associate there before you actually bought out one of our old accounts, Dr. James Wright's practice? But how long did you associate before you went and jumped all the way in and bought your own practice?
Let's see. I bought this practice last year. So, so I worked for a corporation for about 4 years, 4 or 5 years.
That's awesome, though. I mean, it really did because, and probably you can only use certain products in that place. And it was all probably limited on what you could really do and what you had to do, where you have your own practice now and you can, pick your own lab. You can, use the products that you want. And was it kind of limiting when you worked for someone on, getting even... Did they give you good equipment to use and the right impression materials, or did you have to just use and just be real stingy, or they were stingy with their burrs and everything? Tell me a little bit about your experience in those 4 years.
So I would say my experience in that 4 years, I would say you can give me anything. You can give me like a round burr and tell me to cut a crown with it. I feel like I'm able to do that only because of when I started when I was working in the dental field as a dental assistant, like I literally went from when they were just placing amalgams and when composites were first coming out. So, and then working for different dentists as a dental assistant, you figure out how to make temps different ways, crown forums, and then stainless steel, you figure out. That's why I love dentistry too, because there's so many different ways of getting the same result.
That's huge.
So, yes, working for a corporation, it could be, I would have said it could have been more painful than it was. But yes, they limit you on what labs you can use, what materials you can use, things like that, equipment. Sometimes, you'll work for a corporation and they won't get just simple things like Cavitron tips, for the hygienist. They won't get oral cancer screening devices. I mean, to me, it just seems like the basic necessities that you want to use to practice dentistry, they're really stingy on, and they don't give you those things.
Yeah, it's all corporate. It's all about crunching the numbers, counting the beans, and that's just not. Hey, this is dentistry, man. There's a person behind there, man. Let's show them some love. Let's treat them well, and let's use some good materials and products in them. It's just, I think that's awesome. That's what you're doing now, and you're crushing it, man. So what about with you on your practice now? So tell me a little bit about the practice. How big is it? Tell me how many associates you got, or no. Tell me a little bit about that.
So when I purchased this practice from Dr. Wright, it's very conservative. Mm-hmm. Here with the older population, they were just radiation phobic. Like they don't want x-rays. And, I guess you get to a field when you're an older dentist that, patients are screaming, they don't want this, they don't want that. And you just start saying, yes, yes, yes.
Yeah, exactly.
So when I came here, I had to explain to them, this is the standard of care. I had to put in new equipment, meaning computers, because the older computers, if you want to incorporate DEXIS, digital radiographs, you can't put DEXIS on something that you don't have enough, gigabytes or enough memory.
Enough RAM, maybe RAM. I don't even know.
Yeah, you need more RAM and stuff like that. So, yeah, I had to come here and basically start from the bottom and build the practice up. There was lots of loyal patients. Everybody loved the previous dentist. And I always tell people there's a way. You'll see a lot of new docs go in, they'll buy a practice, they'll fire everybody, and they'll tell them everything you were doing was wrong. And that's just not my philosophy, because I've was an assistant and I've seen that before, and never goes over well. So having to just reteach them, re-educate, hey, these are digital radiographs. There's not a lot of radiation, when we're taking these x-rays. This is the purpose, of why we're taking these images. And then sometimes I use the analogy, because everybody here has had a knee surgery, knee replacement. Mm-hmm. And I said, would you like your orthopedic surgeon to go in and do your knee surgery with no map? They're just going in there and going, this doesn't look good. Yeah. And then, and then they just look at you and come up with this diagnosis, and you'll say, well, how did you come to this conclusion? And I said, that's exactly what a radiograph does for us. It gives us evidence to say, okay, this tooth is not healthy. This is the reason why we need to treat it. And I need some type of map to see where I'm going. So, so things like that. Our practice is primarily, I would say, average age is probably about 85 years old.
Dang. And they're worried about an x-ray. It's like, dude, man, an x-ray ain't going to do nothing to you. You're 85. Yeah, you got to... Oh, Lordy, but let's do a freaking roundhouse on you. No.
Well, my thing is people are living a lot longer. So, before 85 is like, oh my gosh, you're going to die in a couple of years. Yeah. But, like I said, our patients are a healthy 85, I should say.
Yeah.
Average. I'm the only dentist here. We have 3 full-time hygienists. I have, when I came here, there was only 2 assistants. Okay. And I said, there's no way I can do everything I want to do with 2 assistants. So built the practice we have 3 full-time assistants. When I first came, there was only 5 rooms. So I transferred another room to one of the doctor's rooms. So we have 6 operatories to work out of.
No kidding. And 3 full-time hygienists, baby. That's awesome.
It's definitely busy here. Busy.
That's so cool. Now you're crushing it. Dr. Wright, he's a great guy. And, but it's like your practice is really blown up. I mean, one of the top practices, and it's not even super busy time of the year. We were talking about this yesterday a little bit. It's like, heck, we're kind of crushing it too. And it's like, it's May, and it's like, it's kind of the slower times, May, June, July, summertime. And, we really
Yeah,
start
usually we have a lot of snowbirds and everybody's supposed to be gone. But yeah, like you said, like I said, this year, last year too was like that. We thought it was going to be slow and we thought we are going to maybe reduce to summer hours, but we've kept the same hours and it's been just as busy. Actually, we double what we did last year in the summer.
No
So it's been great. It's been a blessing.
Man, we're going to double it again this year, baby. Let's do it up. I'm here to help you. We'll do whatever we need. We were talking too, maybe getting a scanner over there. Maybe start scanning these things. They'll save a lot in shipping, but that's awesome. Yeah. What a trip. So tell me, what's kind of like your favorite procedure in dentistry? What do you like doing? You like crown preps? You like doing root canals? Or what do you like to do? And what don't you like to do?
I'm a general, so I like to be all over the place.
No
We've been so busy now. We're in the process of buying building 2 that's right beside us.
Okay.
And I want to do my surgeries out of there. So I want to be able to do implants and things like that. But if I had to choose, I would definitely say implants would be the favorite. But the procedure, but I would say the procedure that I do the most here would be crown and bridge. I mean, hands down, you can make a tooth beautiful. I mean, I like crown and bridge.
Do you are you outsourcing many things? You're trying to MacGyver everything, or you're probably pretty well versed on everything, but anything you like sending out or keeping in?
There's always a need for specialists. Endo, with the older population, there's a lot of calcified roots and things like that. And some patients will beg and go, please do this root canal. I'm like, it'll be better if you go to a specialist. They'll be done a lot faster. They're specialists. They're great at what they do because, that's what they specialize in. So a lot of times we'll send out our endo cases. We'll send out if implants need to be placed. We'll send those out to a specialist.
No kidding. Well, that's smart, man. You're young. You'll get that down the line, especially if you get that building next to you. Have your home, oral surgeon. You could have your own, endodontist if you wanted, or it's just, and then have them work for you. It's just like, hey, you know what? I get 60%, you get 40, and that's the way it works. I'm the owner, and so you're not working harder, you're working smarter.
Yeah. And a lot of it too is just comfort of the patient. Like I said, specialists, that's what they go to school for. That's what they're great at. I always tell, like when I first came here, they were saying, oh my gosh, are you going to send that out or you're not going to do it? I was like, look, if I feel like a specialist can do it 20 times better than me and the patient have a great experience, why not? It's a lot of times it's not about the money. Or same thing with the lab. If the lab does a fantastic job, you don't want to, sit there and send it to this crappy lab. And then all of a sudden you're replacing it in 2 years. Yeah. It's not worth it. Yeah. I want what's best for the patient. I like great products and I want my patients to feel great and receive great care.
That's awesome. No, it's a good attitude there for sure. So what are you doing to like marketing strategy? Do you do mailers, social media? Are you working in the public sector? Tell me a little bit about that.
So believe it or not, even though you say that I'm young, I don't have any, I don't have Facebook. I don't have any social medias. I don't deal with any of that stuff on the internet. The only thing we really have is a website. Okay. And, since this is a retirement community, people read the newspaper. Okay. So we just old-fashioned newspaper, the Green Valley and the Sahuarita Sun that we use.
Oh, that's perfect.
Does this pretty well.
And I got probably 80% of my doctors are that same route, and it's just like good old school local newspaper. And, they're not on that interweb and all the social media stuff. It's all those young millennials and stuff. It's all going with them, but it's like, it's just a lot of dental
sometimes
practices.
I always say you don't need that. And then if you have great patients in your office, word of mouth, people will tell their family members. Or like I was at the gym the other day and this lady runs up to me and says, you're seeing marketing person at Green Valley told me to come, the newspaper lady told me to come and see you. And I've heard your name all over town, so it's a small community. Yeah. If you're good at what you do and you treat people, how you want to be treated, they'll come.
Golden rule, baby. That's so good. How many population do you have in Green Valley? How much people?
Oh, I haven't even looked that up. I have no idea.
Probably like Green Acres, man. You got 347 people. No, you can't
No, it's
because
not
I
that
know we've
small.
seen that many patients last month. No, that's amazing. No, that's so cool. Small little town, man. They all know you. They know Dr. O. Man, that's so cool. So, what's the latest piece of equipment that you purchased in your practice?
The last thing that we got, this was a while back ago, was a diode laser. That's pretty
Okay.
cool.
Cool. What time did you
We
get?
use
Did you get an AMD from Alan Miller Dental? Or no? He has a Picasso light. That's my good friend Alan Miller. Shout out to Alan Miller. How you doing, baby? If you're listening, I love you, man. No.
It's a BioLace, so
Oh, we got them. They're right in our backyard, right here in Lake Forest, right next to Irvine BioLay's headquarters. And those guys been around forever. They've been around a long time. A little more expensive than a lot of the other ones, but they're coming down, I think, in price and stuff. But yeah, those lasers are
yeah.
neat, man. You can do a lot of stuff with those.
You can. It's like practicing dentistry just differently.
Yeah.
The hygienist, same thing. When we got the laser, we took everybody for a hands-on because I'm big with CEs.
Yep.
I don't like CEs that they're just talking to you and you're sitting there and shaking your head, and you're writing in the book, because chances are when you walk out, you're not going to use that information. So it was the first part of the morning was going through everything. I ended up getting certified twice, but
okay.
You go in there and, they teach you, all the physics and all that stuff.
Mm-hmm.
And then the second part is we're going to use a laser, but guess what, guys? We're going to use them on you.
Yeah.
So anybody who wasn't paying attention, guess what? The laser is going to be used on you. And, it's not going to be good.
We're going to zap that mole on the end of your freaking nose and show you how we take that off with this laser too. No.
Yeah. So they were, at first, everybody's skeptical about new technology and things like that. But once they saw that, oh my gosh, you can use a laser for that. Oh, yeah. And you can use it for this. And I said to them, laser's been being used in every profession, and it's shocking that dentistry is like one of the last people that it's actually being used now. So it's been fantastic.
It's neat.
That.
I mean, back in the day, all you had was that electrosurge, and man, that thing would smoke
gosh,
in your mouth, and it's like smoke. It stinks so bad. I'm like, what are you doing? We're cleaning up the tissue, Sean. Like, man.
I was like, one moment, patient, let me put this plate behind you. Like, what is that? It's a ground plate. Don't worry.
Yeah, we need to ground you. What about my ticker? I got a ticker though. Oh, dang. That's crazy. So tell me a little bit about your CE journey. What have you done for continuing education? Any practice management courses out there? I'd like to say, I got a lot of younger dentists out there. You're young, but tell me a little bit about your CE journey, if you could.
So CE journey, let's see. When I did work at this one corporate place, believe it or not, they had paper charts still.
Okay.
And it was, the 21st century. So then when I came here and we use Dentrex, I had to take everybody to training. So I would say that for the most part was our practice management that we train hands-on with the Dentrex leaders and stuff. So they were able to show us that. Everybody here does spears, which is great.
Oh, you're kidding. Yeah, I knew. Yeah, you had to have something because you just really like a freaking 20 plus year veteran as a dentist, and you really do got a good system working. Your staff is on point. You guys sent us great impressions. So little spear education for you, huh?
Yeah, spirit education is great. As a dental assistant, it's good to, like I said, work in different offices and see what worked, what doesn't work, but it's hard to put everything together. So a lot of times, like if I go to CE and they don't come with me, they look at me like, what are you talking about, Doc? Why are you requesting all this stuff? So I figured either I'm going to take them with me or once a month at the beginning of the month, the front desk does their spears meeting, the hygienist does, the dental assistants, and then I usually do mine. And then on Wednesday in the middle of the month, we all come together and then we discuss, like, what did we learn from spears? Are we doing this right? Should we change this? And they're more involved because usually there's one person that leads the meeting. Everybody watches a video and then they discuss it. But, and they rotate, like, who's the leader. So everybody's held accountable. And then, and they'll call each other out, if someone does something and it's not like exactly right, or we go, well, how can we, fix that situation? So doing spears has been a blessing.
That's so cool.
And like I said, I love hands-on. The last place that I went to, Dr. Isaac Tao. He does AIG, American Implant Educators,
Okay.
AIE. What he does is you go to San Diego,
Okay.
you do a class, and you're talking about implants and things like that, and placements and stuff like that. Then we actually went to Tijuana. We crossed across the border, and you place all the implants you want. And I think it was like 5 days. And I mean, we're doing crazy stuff that I would never do as a general, but you have an oral surgeon, right there.
Yeah.
And by the end of the session, we placed like probably 300 and something implants, like
You're
each.
kidding.
It was tremendous. And kind of like I always say, I can go to all the implant CE that I'm sitting down, trying to understand that information. Not until you're actually touching it and doing it does it really, translate in your head. Okay, I know what to do at this, situation, or I know what to do if this occurs.
Yeah, because it takes some big cojones to go in there and pull flat back and actually do it. I mean, you can read about it and get all the theory, but unless you got hands-on doing it, and to have so many patients to be able to say, okay, let's look at this. Okay, we got this space, man, and screwing those implants into their bone, man, that's just scary. I mean, I've had it done to me, and it was like getting a crown prep. It was so easy, and the guy was just a freaking master at it, and it literally was just like getting a crown prep. And 3 months later, we come and uncovered it and restored it, and unbelievable, the technology. And just even to grafting, where you have bone loss and you have to build it up. I mean, just what has changed in the last 10-15 years technology wise, it's just amazing. So hats off to you, man. Yeah, that's awesome how you can sync those implants. That's so cool. So what are your thoughts on some of the new technology in dentistry, like impression scanners and CAD cam? What are your thoughts about that?
I love it. When I worked for another place, we were doing Sirona, which is a closed system, but at least it gave me experience, with using the scanner and using the milling. When we were in dental school, we did, what was that machine? It wasn't Sirona, but it was...
iTero, or was it?
No, it wasn't iTero. It was a different type of scanner.
That's okay.
Oh, I can't remember it. But anyway, we had a little bit, it wasn't accurate, but it's probably because it was at the beginning phase. And too, like I said, it all depends on what scanning unit you go with, and how easy you want the, transition to be. So with the scanners, they're just getting better and better. So my thing is I'm kind of on the fence. At first, I was thinking, okay, I'm going to get this iTero scanner. I, went to a couple of the meetings and stuff. And then when I was talking to you yesterday, and you mentioned, you said 3D.
Three shape. The three shape trios.
Three shape trios, right? So I go to the website, I'm like, maybe I don't want an iTero. Maybe I want to go with something that, is a little bit more patient friendly, dental friendly, So I go back and forth. The reason why I was like on the fence with iTero is because you have all these drop down menus and you're like, well, what are those for? And they say, oh, we phased that out and now you use this. And I said, well, why don't you delete it off the software?
Yeah.
We haven't gotten there yet. So that's why I always think there's something that's, is going to get updated in there. And then of course, what you have is going to be outdated, and, they're not going to let you, buy another one.
It's tough. It just, it's evolved so much in the last few years. I mean, Atero's a great system and it does work great. And so's, 3M's, True Def, and there's several others out there. I'm just a big 3Shape fan because that's what I've always used in my lab for scanning, and it just they're built for the lab, and then they got into the dentistry part of it. But they're just such smart software people, and it's just so user friendly for us. And I don't know. It's just it's kind of like, hey, do you like my Ferrari? Do you like my Lambo? They're nice, both of them, but they're just different beasts. They both go fast. They both look beautiful, but it's just different things for different people. But I'm a big 3Shape guy, but that's awesome though, man. We're gonna work it out. We got to figure that out with your practice, because you guys are doing quite a few crowns here and there, and I think it's kind of neat. One of our biggest accounts, he's out of Florida. He's actually getting one right now, and we're excited to see. It's kind of the difference between iTero and 3Shape. The scan comes directly to us, and we got to go through and mark the margins and really clean it up and say, oh, it's okay. Where iTero, it goes to their their shop,
Mm-hmm.
wherever the heck it is, Costa Rica or
Costa
somewhere,
Rica.
and they go
Mm-hmm.
and they do it and they fix it all up what they think is right. And then it comes to us hours later. And I just, you know, iTero's easier for me, but yet I don't have the control that I truly want. And with 3Shape,
Mm-hmm.
it comes directly to me, so it's a little bit more labor on my end, but it's just all my pocket now. When I get it here, it's boom, and we're not waiting on anything. We can instantly talk to the doctor, and simultaneously like call them up, say, dude, yeah, we need this, or it's right on the computer. It goes right here. We need to go a distal lingual. We got to clean that up a little bit, or whatever it is.
Mm-hmm.
But it's just neat. There's pros and cons to all of them, but it's just
Mm-hmm.
something we're excited about for sure. And it's just kind of a neat thing with dentists. I don't want them to get the CAD cam like mill them in their office, but to scan them and send them to me, man, because it just it's just so freaking accurate, man. It's just there's no
Mm-hmm.
line. Impression materials, man, like to shrink, and impression materials are great. They work great. I'm a big poly ether guy. I'm a big Improgum guy and always have been. But there's
Mm-hmm.
polyvinyl guys out there that just it's just they're the greatest dentist. But then, man, when it comes to impressions, sometimes like, dude, you gotta look at this. Why would you even send this to me when you could see the half of the margins folded and you got irregularities and this and that? And it's just like sometimes the assistant's taking them in certain states, and it just,
Oh.
yeah, it's just most of our dentists are really awesome though. They really get it right. They want to do a good job, and it's like when a doctor ends up being with us, they're really wanting to practice good dentistry. We don't got a lot of guys that are shopping for a cheap lab or a lab on a coupon or something. We have a lot of guys that when they come to us, they get to know us, they get a feel for our work, and then they stay with us because we really care like they do, because it's just something, we got to just really work on these patients, everyone like that's going into our family's mouth or your own mouth. And we always say that here, and because a lot of our stuff will be put up on the internet, and you're only as good as your last crown. So we always say, man, just pretend this is going on the internet and this is for your mother or this is for your own mouth. And it's something
Mm-hmm.
we take pride with it. And just like all our dentists, all of our dentists do. And this with, the scanners, they're going to make your practice a little bit, more high def. You're going to be looking at things at very high magnification, and you really can't go
Mm-hmm.
on to the next step till you clear it and click it. And it's just, it's pretty neat. Once it's going to take, a few weeks. Some guys it's a week or two, not even that, a few days. Some guys it's a few months. It's just motor skills and just, your muscles and just getting it down and just being able to scan in the mouth. That's probably the easiest part of it. It's just, but it's such a neat thing, and it's just, it's a great tool. You're still going to do your little temporary and stuff like that, but
Mm-hmm.
and that's a little bit of an impression material you're using for that. But other than that, it's just, I think more so than anything, I think your patients kind of trip out seeing it. It's kind of a neat thing doing that because you can show them the screen and the 3D images and kind of rotate their mouth around and kind of show them what you're doing. And it's kind of
Yeah.
neat there.
Yeah.
But the accuracy, I just think there's so many variables between the dentist and the lab. Teeth liking to
Mm-hmm.
move, and lab has models that like to expand, and stones that like to do things, and oven temps, and there's a lot of variables, but we're taking a very
Mm-hmm.
big one out of it when we get that impression scan, because it's just so accurate. Very, very accurate. Okay, well, let me ask you this real quick. I know you're kind of uh, like into minimal invasive dentistry. Tell me a little bit about that when you say that. And you'd like doing, like, when you say minimally invasive, are you doing like, no prep veneer type things? Tell me a little bit about minimal invasive dentistry.
So a lot of times here, like I said, we are in a retirement community. So sometimes people will look at, say, someone smiles at you and they see like 6 through 11, and they have all these fillings, and they're just old fillings in there, and they're dark. Usually, I won't tell the patient like, okay, you need to replace all of those with porcelain crowns, because we all know once you cut into dentin,
Yep.
it's never the same, and it's kind of like a downhill cycle from there. So not unless the patient says to me, hey, I don't like this, or sometimes I'll even ask them, what do you think about your smile? How do you like your smile? So if they, say something about their smile, they don't like this or that, then yes, we'll suggest to them, you can do this. But we're not going in there and saying like every large silver filling needs a crown to be placed over, top of it and things like that. Because you get a lot of patients that they'll come in here or they'll watch Dr. Oz and they'll say mercury or amalgam is poisonous. They come in there, should I have all of my amalgams taken out? No, you're going to be on a little bit more problems than, you initially started with. So when I say minimally invasive, not unless like the tooth is cracked or something like that, are we putting a crown on there, or not unless the amalgam has like decay underneath there, we're replacing it. We're going to put a composite in there. We don't do any silver fillings or anything like that.
Okay.
But usually that's what I mean when I say, minimally invasive dentistry.
Oh, that's awesome. Yeah, it really is, where everything's a crown. Now, for some guys, it's just do the right thing. And minimally invasive is you're going to do what's needed. And I think the patients see that and feel it, and and that's why they like you so much, because you're doing what's needed and in letting them know when you do need this or you don't need this. And some people go in and let's cut it down, baby. Do them all. 6 or 11. Oh, man. Well, what kind of advice can you give some of the newer dentists starting off, seeing that you've kind of went through this pretty recently, and any do's and don'ts and any advice you can give some of the younger people starting off?
I would say for the newer dentists starting off, if you have to work the corporate route, don't forget that you have a voice. I would say speak up if you see something going on, or make sure that you can actually lay your head down at night on your pillow and sleep comfortably, because a lot of the times you're working for these places and all they care about is the bottom line. You got to remember there's people, behind those teeth.
Exactly.
There are, you just got to, think about what you're doing. Everybody's learned what the standard of care is.
Yes.
If you don't feel comfortable, like you said, just kind of grinding teeth down to a nub, and you and your heart to heart feels like this is not the right treatment for this patient, speak up. Don't be afraid. I would say for, the dentists that are out there and practicing already, or even like, newer docs, a lot of times, you take a practice over, or, maybe you bought a practice and all of a sudden you're seeing all these patients in there and you're seeing open margins and things like that. I always tell people, don't dare trash another dentist.
Yeah.
Say, this is what, this dentist did that was best, because patients always look at you and say, well, was it my dentist's fault? Like, how did this happen? Things like that. My whole thing is, no one goes out to do anybody harm, our first thing is do no harm. So they did whatever they did, they did the best work they could in, that allotted time that they had, because we have a lot of our patients that'll push your nerves, or they can't open, or they're gaggers. There's all kinds of circumstances that could have resulted, in the work that they've received. You don't know. So I always say, before you trash another dentist on their work, or say, hey, why is this root canal felt short? You got to think about, well, I wasn't there. I don't know what the situation was. Maybe that's as far as it can go,
Well, it's like they say, hold your tongue, hold your tongue. And it's just, if you don't have something good to say about somebody, don't say it. And it's hard to do it. I'm finding that later in life. Hold your tongue, Sean. Don't say what you feel all the time. And the Lord says that you gotta hold your tongue. And I'm starting to do that more and more. It's like, especially too, you're right. That you shouldn't bash that dentist or whoever. Just talk and try to paint the picture as bright as you can, but don't throw the guys under the bus. You're all in the same profession, and there could have been a lot of variables that were at that time, and who knows. But too many times guys in the same cities and practices a couple blocks away, they kind of throw each other under the bus, where just praise them, and the person will probably look at you better. Yeah.
I am never opposed to saying, hey, your dentist did a fantastic crown, or, your dentist did a great job here. Like, who was your dentist? And, they'll tell me, and, I'll say great things about it. Like you said, we're all in this together. Where I practice here in Green Valley, I have, a dentist across the street. I have one right side by side to me. And then I have 3 corporate places right down the street. So we're all in close proximity. It's a small town.
Yeah. And you know what? When they start hearing Dr. O saying great things about all of them, the people see that, and they know that, that guy's a knucklehead, and she still said he's a nice man. She's a saint. Saint O. That's so
Gotta use that one.
That's awesome. So, would you recommend this dental profession to your son or daughter in the future as a career choice?
I would just say do this job if it doesn't feel like work. You got to love what you do. I
Yeah.
come in and like I said, the people that's on my team, we are always laughing. People come to the office and they say it's a positive energy. It's like it's contagious. You got to be happy at what you do. If you have a miserable life and you come in the office and you basically instill being miserable to everybody, they're going to feel that. They're going to know that, this person doesn't like what they do. Why would I let someone work in my mouth that, they don't appreciate their job and stuff like that. So I would say, yes, do it. Do it if you love it. You can't do a job because of the money.
Yeah, absolutely. Money will come, and you just got to do what you love and do it with a passion, and it'll come back tenfold for you. So, man, hats off to you, man. You're a rock and roller, girl. You really do. You really awesome attitude, and I haven't talked to you ever here, and gosh, it's so nice talking with you and just your spirit, and that's just awesome. You really are crushing it too, and let me know whatever I can do to help you out here. If you ever have a tougher cases, right? Tension Sean, call me, and then we'll just work it out. I'll treatment plan it with you, work it out, and if you ever not sure with some of the patients, we need to do some wax ups or something. Just get those out to us. Say, hey, Sean, let's work this up. On this upper grill or lower, whatever you want, and whatever we can do to help you and your staff, practice better, let us know, because we'll do anything we can to help you guys, because we really appreciate all the work and, just all the good work. And if you ever have any problems at all, please, feel free to call me anytime, man. That's just, that's really cool. I hear you're getting married soon to another dentist now. What's going on here with that? Is it a local guy in town? Is he the one across the street?
No, he's actually on the other end of Green Valley. Yes, he's
perfect. We're gonna own this town, baby. We need to have a 20 practice.
Wedding date yet, but we are in love, and it's just life has been so busy with so many blessings. Like I said, when we got this office, it was so quick to transition. As you know, you've worked with Dr. Wright. He is just fantastic, honest guy, and you don't really meet too many people who are like men or women of their word. Like what he said was what it was, and very helpful. It's just an easy process. So same thing, we're in the process of getting the building too. So I'm building that out. It's like, who has time to, plan a wedding? Hey. So many good things going on.
Save all that money, man. And whatever the parents, if they're going to help out, cake that money. Just go to Vegas, get a quick wedding, and save that money and buy property, man. It'll come back better. Get some good pictures. No, that's what me and my wife did. We didn't have two nickels to rub together when we got married in 1984, man. We drove down to Vegas, and it's like $149, and we had a room with the heart tub in the middle of it. We had the limo to
You're lying.
I swear, man, it was Imperial Palace. We got the license, we got the limo ride, we got the hotel room and the marriage license at the little white chapel. And when they were going dun 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 on the record, it went and they like scratched. I had to do it over, and it was like, hey, 33 years later, it's we're still going strong, baby. So it's all in God's hand and His time. So fancy wedding, schmancy wedding, don't matter. As long as you love the guy, and it'll all work out. All it takes is love. So congratulations, man.
Thank you. He's a great guy. We were dental study partners together. So
perfect.
It's great relationship.
Man, we're gonna own Green Valley in a couple of years, man. We're gonna be going the O's. That's
Speaking
so cool.
of that, it was funny. This periodontist just came in, and he says, "Why do you have all that equipment on your desk?" And I said, "Well, I'm going to be doing this podcast with Keating." He goes, "Keating Lab? I haven't heard of it." I said, "Well, you should. They do fantastic work." We're trying to figure out how he's going to be able to maybe come to this practice while we're having the other one built out. out to do like all in fours.
Yeah.
And he says, well, I use this local lab. And I'm like, you got to use them. They're fantastic.
We do those all in fours.
I'll give you information.
Every day. We love them. Those are like $5,000 cases. Oh, or 4 to 5. It just depends. But I love those. They're neat, man. That's so cool. Now, hey, we'll hook them up, baby. Tell them we'll do his first one for free. You guys work it out. We'll figure it out to woo them.
Yeah. Once we get everything like set up and stuff, I want him to see a couple of cases that you guys have been sending me. It's going to blow his mind because he only uses a local lab because it's easier sometimes, when you have a couple of questions and stuff, if the technician just shoots their way down here. And I said, well, like he's an older guy. I said, well, they can always do like a video, like, conference or whatever. There's all kinds of ways now.
We can Skype you. We can go to meeting you. We can pull you up real easy. Just send you a link, open it up, and there we are. And we can show you what you got and what you can show us what you got. And it's pretty neat, man. It's really neat. And heck, we've been known to fly out to different dental practices. We have to just to talk with people and, it's just something working together as teammates. It's important, and finding guys that want to really do great dentistry it's an awesome thing to find them. And we're here. We do it every day. We love it here. I got a bunch of happy people here too, and it's they're like looking at me. I got this big window like on the Flintstones at the rock quarry where you look down. I'm looking at all my texts. They're kind of looking. They're saying the boss is here at 4:30. They're like, "What are you doing so late?" I'm usually I got to go pick up my little monster French bulldogs at the doggy daycare here, and my wife's texting me, "Hey, are you done yet?" "No, we're done now, baby." No. Well, hey, Dr. O, God bless you and your family and your staff. And man, thank you so much for all that you do. And can't thank you enough. And please let us know if there's anything we could do for you.
All right. Sounds great. Thank you, Sean, for calling.
All right, man. Good talking to you. And we'll talk to you real soon.
Okay.
All right. Bye-bye.
Bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.